In this morning's Health Watch, finding ovarian cancer. This year, almost 22,000 women in the U.S. will be diagnosed with ovarian cancer, and nearly 14,000 will die from it. It is a very difficult disease to detect, and according to a new study, the current screening tests only slightly reduce deaths. So what should women do? Our Dr. Jennifer Ashton, who is an OBGYN, is here with some news for us. Good morning.
Good morning, Betty.
All right, according to this new study, those annual screenings, they only reduce ovarian cancer deaths by 11%. Why so low?
Exactly, and being called by the American Cancer Society only a modest reduction in risk from dying of ovarian cancer. The reason for that, Betty, is that they are not accepted screening tests per se. They are all we have, and what we're talking about here specifically is a physician exam, a pelvic exam by a gynecologist, a pelvic ultrasound, and then usually most people have heard of a blood test known as a CA-125. They are not 100% accurate, not even close. So they can give you a normal result when there is in fact ovarian cancer there, and they can be abnormal when there is no ovarian cancer there. And it's important to remember, Betty, and I say this to a lot of my patients, with that blood test, the CA-125, there are actually about 6 other blood test markers that women should get, and they should ask their doctors for if there is a suspicion for ovarian cancer. Most doctors even are not aware of those other markers, so they should ask for them.
The key really is to finding it and detecting it, but it's difficult to detect, correct?
Exactly, and the reason for that is because of where the ovaries sit in the pelvis, in the abdomen. They present with very, very vague and common symptoms. A lot of them can be missed by not just the patient or misinterpreted by the patient, but also the doctor. So the big ones that we think about when we think of warning signs or symptoms of ovarian cancer, pelvic pain and pressure is the biggest one. Indigestion or a change in the way that you eat. You might take a bite of food and then push it away saying you feel full. Stomach swelling or pelvic bloating, burping is a big one, and then changes in your urinary habits. So frequency of urination or an urgency to urinate more often. If you have those symptoms for more than 2 weeks, you should talk to your doctor and you should ask to be examined by a gynecologist.
So those are the symptoms, but for other women, how do you know if you're at risk?
Well, generally the risk of ovarian cancer for all women is about 1 in 70. It goes up as we age, so over the age of 55, if a woman has never had a baby, if they have a history of ovarian or breast cancer or colon or uterine cancer in their family. So these are things that really should be on the forefront of their radar, and talk to your doctor about getting those tests.
Very quickly, how can you reduce the risk?
Birth control pills have been shown to reduce the risk, tubal ligation, healthy diet, all those things are important until there is a great screening test. All we can do is be aware of the symptoms.
All right, be proactive.
Absolutely.
Dr. Jennifer Ashton, as always, we do thank you.